Hello everyone, a warm welcome to all of you and thank you for joining us once again for Chiropractic and Physiotherapy, Health and Wellness. Now, in our last session, part 1 of this topic, we talked about the changes that begin to happen to the body as we age. And those hormonal changes cause a lot of changes with our muscles, our bones, our joints, our tendons, our ligaments, basically our musculoskeletal structure. Now, we said for us to age healthily, and gracefully, then motion is the lotion for the body. And today's session is about putting this into practice. We want to look at practical tips in our everyday activities to help us move safely and keep us mobile, flexible, strong, balanced well, and confident. Now, joining me to discuss all this is our experts. Once again, we have Dion Jogo on my right. Dion Jogo is a physical therapist. She has been a physical therapist for over 43 years. Welcome to the show again, Dion.
Thank you very much.
And on my left is a doctor of chiropractic, Dr. Peteka Inangombeni, but we call her Dr. Petty in short. And Dr. Petty has been a chiropractor for over 8 years. Welcome again, Dr. Petty.
Thank you.
Now we want to begin with how do we stand right? And for this, I'm going to get Dion to just practically demonstrate on how to stand right. Now I'm going to be the one being demonstrated on. So Dion, how do you tell your patients to stand right? What is the proper way? Because we all stand in different ways. I could have my leg in front. I could lean to one side. Yeah, we all stand in different postures. Yes.
Thank you very much for that question. What I would say that because we are talking a topic of growing or adding years to our lives, the first thing what happened with young people, they will stand anyhow. For them, they can compensate the posture later. But as we go on increasing our years or being old age, is that we tend to stoop. You will find most of people stoop this way when they are walking.
Oh,
They
okay.
are not aware,
Like this.
but they feel stooping. They stoop everybody, trying to show us that the back is weaker. It is not able to hold them. The other thing is that we have relaxed our muscles of the stomach. They are no longer supporting the spine from the back. So the correct way of standing, even if you can be able to stand the correct way, even if it is 2 minutes, it has very good effect on the spinal muscles and also on the tummy.
On the core.
And the core. So the best way to stand is always to feel your ears.
So I should turn this way?
Yes. Your ears, the shoulder, the hip, and the ankle joints are in one line.
Am I in one line?
You imagine that.
Oh, we imagine that. Okay.
You are all 1, 2, 3, 4. They are in one line. And when you stand, you feel that is okay. That's what we call being gentleman or gentle lady. Because when you are gentleman, you feel you are standing upright and erect, such that you feel comfortable and happy and being happy into people's places, and then you feel you are the best positioned person. The next thing is that you feel taller than your height.
Okay.
Imagine,
Taller than my height.
always taller than your height, such that maybe wherever you are or with your colleagues, you feel as if you want to be taller than them. When you feel that way, it helps
So like what I'm feeling, I'm taller than you.
you find that you suck your tummy, or what we call the
Or
muscles.
it automatically tighten.
So
Yes.
long immediately you feel taller than your height, it makes you suck in your tummy. When does the tummy get sucked? It is because it is the corset of our lower back. So when the tummy is well positioned by sucking in muscles, the spine becomes erect. And that way, you will find that if you practice this, you will find that the stooping is quite difficult. But you have to keep on practicing and reminding yourself, I must stand upright.
But most of us are this way.
Yes, most of you stoop forward.
So-
Even the young people.
So to do this requires extra strength, really.
You need to
And
practice.
it needs practice,
Yeah.
and it might not
Aware.
be possible to
And
do
be
this for
aware.
quite long. Okay.
Yes.
All right. So be conscious and do it slowly by slowly until it becomes
A habit.
a habit.
Yes.
But yes, this does feel
Yeah.
like this is straight. This
Yes.
is actually
When
straight.
I mean you feel taller than your height, you don't have to put your head.
Oh,
hands. It is a
Stiff.
natural.
Okay.
You look to
I
your
just-
friends,
okay.
but you feel as if you are being taller than them.
Okay. So
Yes.
how do you walk with this?
No, I didn't say that. I said it is natural. Feel taller than your height. The balance between your legs, your knees, your hips and shoulder makes you just relax
Okay.
forwards. You just relax the shoulders forwards.
Forwards.
There.
This way.
Yes.
Ah.
Yes.
Oh yeah,
I mean-
this is a bit more relaxed. Yes.
Yes.
Okay. Yeah. This can work. This can work. Okay. All right. Yeah, this can work. So there you have it, folks. When you're standing, make sure your feet are 1 foot apart, and then feel taller than you already are. And imagine there's a straight line from the ear, the shoulder, the hip, the knee, and the ankle. So automatically your tummy muscles tighten.
You
Oh.
suck them.
Or you suck them,
Yes.
or rather the system sucks them.
Yes.
Ah, okay.
Yes.
All right.
Yeah.
All right. So now let's talk about sitting. Now, when we were younger, we would generally just jump into a chair, sit anyhowly, and the body would recover from poor posture. But as we age, we realize we cannot do what we used to do before, and we are less agile. So, Dion, please let us go through how to sit. Yeah, as our bodies are becoming more and more fragile, how do we sit and keep it safe? And how do we also get out of the seat, keeping it safe?
Okay, thank you for that. The first thing I tell people as we grow older, the first thing is to avoid sitting on a chair, which will do what? Make you slouch. So always look for a chair which will maintain your back straight.
So that's
So-
our sofas in the house.
Those ones for older people,
Uh-huh.
automatically you'll always have a low back pain.
Okay.
When you sit there, automatically you squeeze yourself and find that the back is completely curved. So the best advice is look for a sort of a dining table chair, which whenever you are seated, you feel your shoulder blades are resting on it.
Okay. So we try that.
Yes.
So first of all, how do I sit? Just normally, or sit the way we usually sit?
Now when you are sitting,
Uh-huh.
especially being old, just
Mm-hmm.
you make sure the chair is resting on something hard
On the wall.
next to a wall, so that when you sit, it won't slide. So it is well supported, depending on the heaviness of the chair.
Okay.
So if it is completely supported there, now you can go in to sit. You come in front of the chair, looking forward. Move until you feel the chair with the back of your knees.
Oh, until I feel the chair with the back of the knees.
Yes.
Uh-huh.
If you are not confident to sit directly, you can either support yourself with the hands on the thighs to sit down. But if you feel you are not confident in that, what you do, you stoop backwards until you hold the chair with one hand or both.
So this side
And that side.
and this side.
That is to make sure that the seat is
Firm.
firm and it won't slide. Then you go.
Then you go
sit.
back. Okay.
And feel the shoulders raised,
Okay.
resting there. When you do that, you'll find that always, as I said, the muscles suck in of the abdomen.
Okay.
You don't have to raise your shoulders. It's just relax and let the shoulder blades be on the chair. In case you don't have a comfortable chair, which is making you to step down, the best thing is use a cushion. The aim of the firm cushion is to maintain the ankle between your body and the hip at least in 90 degrees. This relieves pressure on your spine and you are able to sit with your tummy well taken care of. This one you can even cross your legs from the ankle joint.
This way?
Yeah, that way. That way it helps the spine to be in a neutral position. But when you have no support down there, you will find you are keeping on moving, trying to put the feet on the floor properly.
Okay.
So the best thing is always use a cushioned footrest.
A cushioned footrest.
If you don't have, use a firm pillow.
Okay.
Yeah? So that you avoid putting any cushion behind your back.
So the back should always be
resting on the chair. Dining table chair is the best. And if you have to cross the legs, it is at the ankle joint. So with that, you can now even read. You can use your phone.
You can watch television.
You can watch television, but you don't have to change the posture. Immediately you feel your shoulder blades are away from the chair, you have changed the position of the spinal column. So you should be able to do it, to stay upright that way. Make it a habit. You'll find that even sitting, stooping this way, it is aching even your stomach. Immediately you move this way, you start feeling aching here and the upper back. So always feel the upper back completely rested.
On the chair.
Yes.
Okay.
And the feet, since they are relaxed, your hips and the spine at a good angle, 90 degrees.
So this and the torso are at 90
degrees.
Any angle for the knee and downwards?
Knees will be controlled by what you are stepping on.
Okay.
Whatever cushion you are stepping on, but don't use very soft foot rest.
Not very soft.
Not soft. If
a
you
hard cushion.
A wood cushion, well padded.
Well padded cushion.
Yes.
Okay.
Yeah. That's the way we are supposed to sit when we are relaxing, as you said, reading a book, or you are watching TV, or having friends in a table and you are discussing things. You should always have that position to sit.
Okay. This is actually very, very comfortable. And I believe we can do about 2 hours this way before we stand and get a break.
Yes.
Yeah? So what about now getting out of this position?
Getting out of the chair, the first thing is you remove the cushion.
Or the footrest.
Then you slide forwards.
So I slide forward.
Yes. If you are strong enough, you can stand up like straight away.
So if you're strong enough, you stand.
Yes. But if you are not strong enough, you have to support yourself with the sides of the chair.
Okay.
Any side can help.
Okay.
You can use one hand until you stand up.
All right.
Yeah.
Or both hands.
And you stand like if you are going like an aeroplane, and then you come up.
And then come up.
Yes.
Okay. So you just don't stand upright.
No.
Yeah.
You slide on the chair.
Okay. So
you do as if you are stooping forward.
Slide.
Then you go
stoop forward
like an aeroplane. Hold your chair and push yourself up.
And push yourself up.
Then you come up slowly.
And
then you remember after standing, you must always feel taller than your height.
Oh, okay.
Yeah.
That is something that you have to be very conscious about, how to stand. So there you have it, folks. How to get into your chair safely, how to sit safely protecting your spine, and how to get out of your chair safely as well. Now let's talk about whether it is safe to carry, and how you should bend and carry or lift objects. So Dion, tell us, is it safe to carry, and how much should we carry?
The first thing I would advise everybody is that even when you are doing your phone, avoid bedding over. The head alone, I think, is around 5 kilos. So immediately you do your phone with the bedding over, you are spraining or making it hard for the neck to become strong. So you are making it weak. 4 kilos, 5 kilos on this position, it is hurting your spine.
Okay.
That is one.
So
Two,
where should we put the phone?
the phone, if you are working on the phone, it should be the breast level.
At the breast level.
So that you don't have to bend your head as heavy as it is to be able to take forward. Always make sure the neck is upright. Whenever you are doing, you are texting.
Okay.
The next thing I tell people, avoid carrying anything beyond 2 kilos. If you have to carry, use a trolley or something like a bag, or you ask a colleague or anybody to carry anything above 2 kilos.
All right. So as we age, we avoid carrying.
Heavy carrying.
Yes.
Because what carries is our legs and our arms. As we grow, these muscles get weaker. If they are not strong enough, you would be able to carry. But even if they are strong enough, I know people want to feel that they can do everything. Let's avoid carrying heavy things by using our spine. Our spine has no muscles to carry, but when you go to carry, you hurt your spine.
Okay.
So the best thing is, if you have to carry something, always make sure it is something you can hold to yourself, like a bag, and hold it next to you. That way it doesn't. Or if it has a strip, you put it across your chest so it hangs on the side, but should be average of 2 kilos. Anything above 2 kilos, you need support or help.
Okay.
The other thing is that majority of us have been used in our lives to be able to pick things or do something, or even gardening. You don't see naturally the people who do the gardening, when they are bedding over, they don't bed with their back straight. So what they do, they have to bed their hips, so that by bedding your hips, you are allowing your spine to be straight.
Okay.
Then
okay,
after that, you will be like, if you are squatting, and then if you have a jebe or a panga, you find that this is the position you take. It's like if you are squatting, but your back remains straight. So even if you have to pick something from the floor, it's the same method. Maintain your spine straight, and then bend your hips and knees. Automatically your ankle joints will do what? And you are able to pick something from the floor,
So you
without straining your spine.
So let me see whether I'm doing that right. You bend your
Hips. Yes.
And you go down and pick whatever
you are
it
picking.
is,
Maintaining, sweeping.
or even sweeping, or gardening.
Yes.
So this
Should be the ones
the back
carry.
should remain straight.
Always straight. Don't bend your back. Yes.
Okay, this doesn't hurt the knees.
No, unless you have problem with the knees, you can't bend the hips without bending the knees. In fact, we bend the hips so as to maintain the spine in a straight line.
Okay.
The knees have to bend because you have to do what? To put weight along the legs, and the ankles support you for you to be able to do what you are doing.
So this motion is very wrong.
Automatically,
When you're going to pick something or do some gardening, this motion is very wrong.
you can see automatically you have curved
The back.
the spine.
Okay.
And the spine has a special curvature,
Yeah.
which is not supposed to be disturbed by overdoing things.
Okay.
Yes.
Okay.
Good.
That's very interesting.
Yep.
It's very interesting. We are learning things. How not to hurt your back when you're bending, and also the use of your phone. So please, ladies and gentlemen, ensure that your spine remains with its natural curvatures as you're doing your daily activities. Let's move on to an interesting topic, sleeping. Now, a lot of us jump into our beds, but as we grow older, that becomes an impossible situation, and we need to do it safely. So Dion, how do we get into bed safely get out without harming ourselves as we age gracefully?
It's a very interesting topic, as she says, because at that age we are talking about, we start having so many aches in the body.
Yes.
So even if you are going to your bed, you have to go in a slower speed than what you have been always doing. So the first thing I tell people, immediately you have decided to go to bed, relax and tell yourself you are going to sleep. So the best thing is to go up to the edge of your bed,
of the table,
and push the bed with your body.
Oh, okay.
To make sure it is also well positioned. If you feel any movement, don't lie. Make sure that it is completely fixed properly, because some places you have a floor which can make the bed slide side to side.
Okay.
I'm sure most of us don't have beds at the end of the room. They are either in the middle or slightly away from the wall.
Yes.
So the best thing to make sure is that the bed is firm.
Okay.
It can't be pushed anyhowly. It is stationed properly.
Okay.
So when you are there, you do the same way we said with the chair. You move to the bed until you feel the bed with your back of your legs. That is the knees. When it is there, as we have said, we are having aches at that time, support yourself with the bed. You can use one hand or both. Just go, stoop a little bit.
So we stoop
put your bottoms behind.
And I sit.
And you sit.
And I sit, okay. So you first start by getting next to the bed.
Yes.
And you
support yourself.
Support
push
yourself.
Your bottoms backwards until you sit.
Until you sit.
Yes.
Okay.
Then since you want to be in the middle of the bed, pull yourself now backwards using your hands. And I would prefer people to stop twisting there as if they want to sit. Just to push yourself slowly, because that is strengthening your arms and it is helping you to use your stomach.
Okay.
Yeah?
Yes.
After you reach there, now you know you are in the middle of your bed. It is comfortable. So lean with one side.
This way.
Yes. And you feel you are comfortable there. Then you bend one knee and put your leg on the bed. And the other one follows later.
This way.
Yes. Then position yourself now from there. How to?
Oh, and then I slowly lie
on the
this
bed.
way. Ah,
yes.
Okay.
So you take time to go to bed.
Yeah.
Don't go in a hurry.
All right.
And that's why people fall or get hurt in the process.
All right.
So make it a real celebration to go to bed.
Mentally prepare yourself for it.
Yes.
So interesting. So is this the correct posture to sleep? Or is this the correct posture to sleep? Is there a correct way to sleep so that you do not harm yourself?
The only position we advise people to sleep on is the side.
Oh, is the side.
And if possible, try to be sleeping only on the left side.
On the left side. So it has to be this side.
Yes, always
facing
practice to sleep on your left side. The reason is that on our left we have the big organ of the stomach, which is the liver. So when you lie on your right, you put too much pressure on the liver with all the contents of the tummy, and the blood vessels going to the body, it will always get blocked when they are going to the liver. So if it's possible and you are not feeling uncomfortable, always sleep on your left side.
Sleep on the left side.
Yes.
And we have done a video on this, an in-depth video on how to sleep right.
Yes.
Sleeping on the side.
Yeah.
And the use of pillows.
Yes.
So in this particular video, we shall not go in depth into that. We are just talking about getting into bed and also getting out of bed.
Yes.
So now it is morning and I need to get out of bed.
The first thing I tell, let me use the word elderly. When you wake up and now you feel the sleep is finished, don't come out of bed immediately. What you do, you wake up, you are awake, lie on your back,
Oh, on the back.
Slowly bend your knees
Bend the knees.
and relax.
Oh, okay.
That way it gives the whole system to correct itself. Even if there was a muscle which was a bit stiff or when you lie that way, for a minute, 2 or 3, it helps the whole spine to do what? To relax.
Okay.
When the spine relaxes, because it is where the nerves messages come from, even the muscle which was tensed will start relaxing.
That's very interesting. I think we all just get out and don't think twice about this.
Yeah.
Okay.
So when you are that way, if you are not in a hurry, you can swing the knees left and right.
Oh, this way.
Yes. So that you feel your spine is moving properly.
Ah, so it's to increase mobility at
Mobility on
especially
your
the lower back.
Yes.
Okay.
Yeah. If you are the people who do exercises in bed before waking up, you bend one knee at a time towards your chest.
You bend this way.
You hold it with both hands and stretch it towards your chest.
I stretch towards the chest. Towards the chest this way.
Yes.
Okay.
You feel a nice relaxation
Yeah.
and straighten back. You do the other one the same way and make sure you feel it stretched. This is preparing your spinal column for the day's work.
Ah, okay.
Yeah.
Okay.
If you're still
That's
an
interesting.
exercising person, you can put your hands together, put them to the left as you put the knees to the right.
Okay. So I get my hands to this side.
Yes.
And as my knees.
That way.
Okay. So it's
Then
a bit of a twist.
Yes. And then the other way around. That helps the spine also to relax and become mobile.
Okay.
Yeah. Even if you can't put the hands straight, you can put them even here.
Okay.
And you do the same thing.
And do the same.
Yes. This is
this,
always
yeah, this is better.
maintaining your spinal column.
Okay.
After doing that, now turn again to the side. Then you, this time...
My hand should come here.
I didn't say you put your hand
Oh,
there.
okay. We are still here.
You are still there. This time the legs go fast. So put the leg down and that way. So when the legs are hanging, use your elbow to push yourself to sit.
This way now.
Yes.
Okay.
And there you are.
That is quite a formula, people.
And then when you are there, you can breathe in and out.
Yes.
Ready to start the day.
Okay, so same thing.
Yes.
I get hold of the edge of the bed.
Push yourself up there.
Push myself.
There. And the same way of waking up. You don't pretend you are waking up straight. The body won't allow you. You will be forced to stoop a bit.
To stoop and move.
Then you move your body straight.
Then become upright. Okay.
Yes.
Okay.
Yep.
All right. That's very interesting. Yeah, how to get into bed and how to get out of bed without hurting yourself. And it's very important to try and stretch or do a few exercises before you get out of bed to prepare yourself for the day. What are the exercises that we can do to keep our bodies mobile, flexible, strong, balanced, and make us feel confident in our day-to-day life? So joining me again is Dion to show us the simple exercises that we can do on a day-to-day basis. So Dion, do we do these exercises while standing, while sitting? What is the most comfortable position to do these exercises?
For people we call seniors, the best exercise to start is, apart from bed exercises, we do sitting exercises. Because their tolerance to stand is usually affected. And it is more enjoyable when they do more than 3 people.
Okay.
When they do it as a group, it is more enjoyable because they do it as a competition. So what I do, I would ask the team to sit down on a chair.
So same way,
Yes.
get your knees as close to the chair as possible. Bend, hold
And
the
push
chair.
your bottoms back.
Push the bottoms back until you sit.
Yes.
And make sure your back, your shoulder blades are resting on the
Yes,
chair.
on the chair. And the other thing, after telling the team, if there are many, how to do these exercises, the first one is breathing. We all forget how to breathe in properly. And when you do that, you put your hands on the thighs, and I tell them to breathe in through the nose and out through the mouth. And this can be repeated 3 times. Breathing in through the nose and out through the mouth. And breathe out, feeling it, the lips going. And that way. That way is preparation to have enough oxygen in the body. I've said these exercises are best when they are done in a team. Being 4 people, it makes it very, very functional.
And enjoyable.
And enjoyable. So after that, because everybody is relaxing, even the lower back, upper back are well positioned. So the first exercise we should do are for our feet. Because most of the time we lose balance due to the inability to balance our feet. So what I do, I tell them to lift up when the foot is on the floor. You lift only yes, you are lifting your feet. I want no lifting. Step down. Lift only from here. Only the foot. Don't lift your ankle.
Oh, so this?
Yes.
Okay.
You hold it there for a count of 1, 2, 3, 4, 5, and let it go. You do that again. 1, 2, 3, 4, 5, and down. You do it to a set of maybe 5 to 6 sets. You repeat it for a child that amount. After that, we go to the heels. Now this time you lift only the heel. You don't lift the foot.
The foot, yeah. So just the heel is being lifted and then down.
Yes. So you lift the heel and the foot, you will feel as if there must be difference between the ankle and the foot. Yeah? The feet should be stepping down when you are lifting the ankle. Yeah? You do it the same way. You hold it there for the calf muscles. Yeah?
You hold it.
Yes. Count of 5 seconds and then down.
And then down.
Then after doing that, the next one is take one leg behind front and imagine you are making a circle with your ankle joint. You lift it off the floor.
Way, and then I take it round in circles.
Exactly. And the other way round.
Oh, and this
way round. Yes. You
Okay.
do them for both feet. Then when you are there, you can imagine straightening one leg at a time.
So I straighten this leg.
Yes.
All the way till there.
Yes. You pull your toes
so
towards
the knee should be straight.
Yes. You hold it there to a count of 5 seconds. You go to the other one.
Put it up and the toes
So face you
me.
and the foot facing up to the ceiling.
The foot facing
Don't
up.
turn it left or right in the middle.
Straight.
You count it to 5 seconds and repeat it 5 times.
Okay.
Yeah?
Okay, yes.
Then after that, I would look for even if it is a pillow or anything, I put it between your knees. Something soft. You put between your knees and squeeze it. You hold, squeeze. You will feel it tightening up to the hips. And you release it not completely, but you relax. You squeeze it again and you release. Again and relax. And that is enough for anybody senior per day. Okay? Then the next one will be our upper back or our arms. Yeah? what we can do is that we might think we are strong even in the arms, but most of us, we are not. So what you do, you imagine the PE, which used to be done when we were in school. You bend, hold your shoulders and straighten. Touch your shoulders and straighten. Yeah? 1, 2, 3, 4, and 5. Then you put them apart there, and you touch your shoulders and straighten. 1, 2, 3, 4, and 5. Then take one hand to touch your shoulder and put it down. The other one and down. We do that to a count of 5 each. 1, 2, 3, 4, and 5. Yeah? Put them on top of your knee and raise them up as far as you can, but don't arch your back. It's only the arms are moving. You don't have to go up to the ceiling. It is to your ability. Let's go.
Okay.
1, 2, 3, 4, and 5. If you remember, we did that movement of touching our shoulder. Now why don't we touch your side of the tummy or hip?
This way.
Hip and back.
1,
And the other one. And the back.
2,
And back.
3, 4.
Yes. And 5. Now with that, that makes us, if you do each set of 3, 3, 3, 3, that makes it much better.
Okay.
Now because you have already stretched your arms, imagine you want your shoulder blades to meet. Hold it there for 1, 2, 3, 4, 5, and it is.
Okay.
Again, 1, 2, 3, 4, 5, and it is. Again, 1, 2, 3, 4, 5, and it is. Now let's try to touch our ears with our shoulders. So you lift your hands up this way and down. Again and down. Again and down. Now put your hands again on the, and imagine you are bending to the side this way. The whole body, if you can, and don't fall off. And come back. The other side. This helps very much in balancing. And back.
Okay.
And back. That way, it helps you to do it. If you can be able to put your hands this way and turn the body as if you are looking to the other side, then you move to the other side again, and the other side. Great. That will make the whole system very good, and your spine is in a neutral position. The next one is to stand from the chair up and down. They are also chair exercises.
Okay.
If you are strong, you can stand straight away. But if you feel you are not strong enough, support yourself and stand.
Move forward.
Yeah, stand
This way.
and sit.
And sit.
And sit.
Okay. Oh, so when you sit in the same applies?
Yes,
You move
but
back.
can you be doing that without moving your legs? Then stand.
So I stand.
Yes. And sit.
Oh, without the legs moving.
Yes, because you are doing
Stand.
an exercise. You are not moving to anyone. If you can do that easily, and you can do now without supporting yourself on the chair, you release the arms, you stand without supporting yourself in the chair. Let's go.
So I release the arms and now just sit.
Sit, yes.
Once you feel strong enough.
Yes.
Okay.
Yeah.
Okay.
And always you look forward, and as you are doing this, you make sure you breathe in through the nose and out through the mouth. Always, because you need the oxygen in your muscles for you to be able to exercise.
So at what point do you breathe in? When you're going down or when you're...
Let's say you breathe in when you are coming up and out.
As you go down.
Yes. And out. One more. And out. Now, let's assume and agree that you have done these exercises and you have a balance in standing and sitting. So can we stand?
Okay.
And imagine now you can move just slightly away from the chair and you start marching. Don't go so far because you feel tired or feel like you are not able to stand, you have to sit. So you don't move very far from the chair.
Okay.
So you go back again. Now when you are there, try to march on the spot and still breathing in and out. Bring your heel, your knee as much as you can.
Or as high as I can.
If you feel tired, you always go back to sitting.
Okay.
Yeah?
Yeah.
You sit, you can even put the knees as if you are doing this, if you can. But it is an exercise of progression.
Okay.
Yeah?
So you start small.
And you go.
Keep going higher.
Yeah.
And then.
Yes.
Okay.
And then when you are sure you have that balance, just walk to the side. Side walking and back these two steps each as you breathe in and out.
Okay.
And focus somewhere where you are looking in front and back once. That way. And I'm sure that way you have exercised enough for the day. Have a seat.
Yeah.
Yes.
Okay.
Yes.
Okay. And you can treat yourself to sitting.
Yes. Now the other one is just for your neck.
Yes.
Which you can do when it's seated. Try to touch your shoulder with the ear and the other side.
And the other side.
You go to your own ability. Yeah, you repeat it again. Still breathing in and out. Yeah. Try to look back.
Sorry, to look?
Back on your...
Oh, this way.
Yes. And the other side.
And this other way as well.
Yes, yeah. So that you avoid having stiff neck. Yeah.
This way.
Yeah, and if possible, you can look at the ceiling without moving your shoulders, only the head and down.
And down.
Yeah.
So you look at the ceiling. And down.
Yes.
So you go as far as you can go until one day the chin touches the chest.
In fact, I don't want you even to touch the chin. The reason is touching the chin, it comes automatically. Because everybody will stoop their shoulders up and they find themselves hanging loosely in front. So that one is not very necessary. What I'm specifying is you look up.
Look up.
As far as you can go and back to front. There. You don't
Without moving the shoulders.
Yeah, and you don't have to go back to the chest.
Or just back to normal.
There, yes.
Okay.
Yeah.
Okay. So up.
Yes.
And back.
There.
Yeah.
That helps you to do mobility on your
neck. Okay.
Yes.
All right.
Those are simple, I said PE exercises, which we used to do when we were young. So they are not supposed to stop because we have changed the life we have been living. So those are chair exercises which are simple, and do them from between 20 and if possible 30 minutes. That is enough for the day.
Every day?
Every day if you can. If not, you can do them alternative days. But if you have a colleague or a neighbor whom you can advise to come, you do exercises together, it is the best. Yes.
Okay. So there you have it, folks. Exercises that you can do daily to make you stronger, healthier, flexible, mobile, more balanced, and also confident in yourself. So as we conclude, we want to hear from our doctor of chiropractic, Dr. Petty. What has been your experience with the elderly, and what would you advise them in terms of exercises and in terms of safely doing their everyday activities?
Thank you very much. It's very important that as an elderly, you should make sure that all these exercises that you are advised to do, they are without pain. If at any point you are feeling pain in any of the joints, it is good to consult and make sure that all the exercises are done properly. So do consult and don't take every pain and ache and just say it is because of old age. Sometimes it is a valid reason to visit your healthcare provider. So it's very important that every elderly or senior person makes sure that all their joints are moving and they are painless.
Okay. That's very good advice. So there you have it, folks. Aging should be graceful and not a horror movie. I have been your host, Nelly Diga. Do have a lovely evening.